I've been in Georgia for 35 years. I've lived in Georgia longer than I've lived in New York, so I'm really a Georgian now. But I moved out to Gwinnett County in the early 90s. I've lived here in Lilburn since 1995. I've raised my children here. My children went to Arcado Elementary, Parkview Middle School. My son went to Gwinnett School of Math, Science, and Technology. I love Lilburn. You know, I've got neighbors here who I've known for, you know, what my children would describe as a lifetime. But, you know, Lilburn is just a very comfortable neighborhood to bring up children. We have virtually everything that we need. It has a small town feel, but a very modern technology to it. What they've done in Old Town Lilburn with the park, and I've just never seen that kind of renovation and upkeep in a small town. A rheumatologist is an internist who specializes in arthritic disorders, autoimmune diseases, and autoinflammatory diseases. Okay. We also deal with metabolic bone disease, like osteoporosis, Paget's disease of the bone, osteomalacia, and then degenerative arthritis, just common wear and tear. You know, my grandmother used to have a saying that you'd love, even iron wears out. We've been in practice for 30 years altogether, and the number of changes and improvements and advancements in our particular area of medicine has been revolutionary. It's been a real sea change. I can see patients within up to 2 weeks with the assistance of my nurse practitioners and physician assistants. My other doctors, we have 4 other rheumatologists, hopefully soon to be 5 other rheumatologists that can serve this community. University trained specialists in rheumatology, and they love these rare diseases, and they're as kind as anything else. You know, I would love to take credit for them in saying that I handpicked them, but you know, I think we've just gotten very, very lucky in attracting really, really good talent to our practice here. It is very difficult to see rheumatologists, and unfortunately the metro area here in Atlanta has lost about 12 rheumatologists over the past few years. Yes, some new rheumatologists have come in, but not at the same rate that we've lost them. So, you know, with our practice, we can get patients in within 2 or 3 weeks routinely. We can get patients in urgently within 3 business days. So, you know, in some of our other practices here in the metro area, you know, the waiting time is anywhere from 3 to 4 months to as long as a year.
I have patients who have rheumatoid arthritis that are 18 years old, and have been told, oh, you're too young for that. You know, there's no way you could hurt this bad. You're too young. Or patients tell me that they have, they say, oh, my back hurts, but it's hurt ever since high school when I played football, or ever since I did gymnastics, you know, and so they don't really get, they don't pay enough attention to their pain because everyone has told them to dismiss it. And when I start probing and find other symptoms, other signs of various types of arthritis, it really helps put the picture together, and to be able to say, oh, well, that's why you have stomach issues, and that's why you have, you know, problems in your eyes, and that's why you have problems with your teeth and your gut, is because of this large category of arthritis that can affect everything.
Over the years, we've tried to build up a turnkey operation for anybody with a rheumatic disease. So the common things, osteoarthritis, osteoporosis, you start with simple things like x-rays. Are the x-rays abnormal? Do you have the common space for the cartilage and the joint lubricant? If they're too close together, if they look like they've been rubbing for a long time, and there are ways of looking at that on x-ray, you know, you need some kind of intervention of some sort. And there are a number of things that we can do. Some things we can do directly, things that we can do in combination with other professionals, physical therapists, sometimes even chiropractors and orthopedic surgeons, podiatrists. We can work with all of them in improving your health. But we also provide evaluations for osteoporosis in the form of bone mineral density assessments, or DEXA, dual energy X-ray. And that tells us about how brittle your bones are. And if we find that you go below a certain threshold, well, you're apt to break a bone, just brushing your teeth or looking out a window.
Turns out rheumatology is really cool. There's a lot of really interesting things that we get to see, and specifically, I like being able to help people who no one else has been able to help. I see that quite frequently with women who get diagnosed with fibromyalgia, and then when they come to us for fibromyalgia treatment, I find that it's not fibromyalgia, it's actually psoriatic arthritis or ankylosing spondylitis or something else. And being able to find that diagnosis and being able to treat them just is life-changing for these people.
So, we're like medical sleuths here. We do a lot of detective work. So we do a lot of lab tests. We do the lab tests right here on site. We send them out, of course, but we draw the blood right on site. We do the x-rays, and we create reports that not only help explain to the patient, but also to the patient's physicians what's going on with the patient. What does success look like in a rheumatic disease? I refer to myself as a greedy rheumatologist, meaning, I want better than just control. I want remission if I can get it. And I'm constantly trying to tweak the treatment to get the best outcome I can get. And the best outcome that I can get is as close to normal as possible.
When we see them, they've had symptoms for several years. They're miserable. They may be on disability. They may be have social issues. That's certainly going to strain relationships, depression, and money problems. And then when we're able to see them and I find what's wrong, it's just it is life-changing, and it does, especially once you get them on medication. And a lot of times people ask me a lot of times people say, so I'm not crazy. And I'm like, well, you might be crazy, but you definitely have something we can fix. So, and that's always very, very rewarding.